Okay, let's move on to the roles and responsibilities of contact tracers. So what do contact tracers actually do? Well, they communicate with contacts, as we mentioned before, to notify them that they've been exposed to COVID and to provide information and education about the disease and in particular, how it's transmitted. They also talk to contacts about their living situation, how many people they live with, how big is the space or their shared spaces. This is going to help the contact tracer work closely with the contact to successfully quarantine. Contact tracers also ask about medical status. So they definitely ask about whether they have any signs or symptoms of COVID, whether they have any underlying medical conditions that might put them at risk for more serious disease, and they provide referrals for testing. And finally, contact tracers provide recommendations to contacts around how to maintain their health and the health of the people around them, how to follow quarantine instructions. Now, this can be really tricky for some people, especially if there's several people living together in a small space. And a contact tracer can help problem solve and troubleshoot. How to monitor for potential symptoms of COVID so that they know when to get medical help if needed or when to call back the contact tracing team if they have questions. And finally, contact tracers provide referrals to services that will help them stay healthy and successfully quarantine. So let's define what is a close contact. Now, these are people the case is in contact with intimately, such as intimate partners, household members, anyone the case may have coughed or sneezed on or shared utensils with. Now, there's a definition beyond those of a close contact, and that's being within 6 feet for 15 minutes or longer. And that can happen in a number of different settings, such as at work with work colleagues or customers, at large gatherings like at church or at a party. Any visits to congregate settings, long-term care facilities, skilled nursing facilities. This can include correctional facilities or schools, things like that, or any other close contact settings. Now, it's important to know that some contacts are prioritized for interviews right away. That includes any contacts who are already having symptoms and those who are at high risk. Now, that includes people who are age 65 or older, if they have any pre-existing medical conditions that can put them at higher risk, if they are immune compromised, or if they are pregnant. Now, let's get into a little more detail about what actually happens during a contact tracing interview. Contact tracers have to ask a lot of questions, and here are some types of questions that are asked. They ask demographic and contact information. So, for example, their date of birth to make sure they're talking to the right person, or other contact information, so there's multiple ways to reach the contact in the future if needed, for example, by email. Preferred language is very important. You need to know that the contact tracer and the contact are able to communicate clearly in the contact's preferred language. Now, if you as a contact tracer don't speak that language well, there's other options. There could be other people on the team who could conduct the interview, or there are interpreter services to provide interpretation during the interview. Contact tracers also ask, as I mentioned before, about the living situation. So how many people are living together? What are the shared spaces? And this helps you support the contact in how to safely quarantine. And finally, they ask questions about medical conditions, and in particular, any conditions that can put them at higher risk. Now, some questions contact tracers ask are checking for any high-risk settings that transmission may have occurred in. So, for example, asking their occupation, especially if they're a healthcare worker or another type of essential worker. And any other exposure settings where they may have been exposed or exposed other people. I want to mention a few high-risk settings that contact tracers need to be aware of. Now, these include healthcare settings, residential or long-term care facilities, any facilities for seniors or for childcare or correctional facilities. Schools are really important, homeless shelters, or single-room occupancy sites. Now, if you find out in an interview that a case or a contact has been in any of these settings, then it's important to let the team lead or supervisor know, because this could be a situation where there needs to be another team, an outbreak team, to make sure that there isn't ongoing transmission in those settings. Now, after a contact tracer has asked all of these questions, let's talk about what information contact tracers can then provide. First of all, they can provide recommendations for how to quarantine or isolate to limit ongoing transmission. Similarly, they can provide resources for housing if isolation is needed, but it's difficult for the contact to do. Isolation can be really difficult. We're asking a lot, and especially if it's difficult in their specific housing situation, there may be other resources for housing. Contact tracers also provide information about referrals for social services that may assist the contact and their family in order to safely quarantine. And finally, they provide follow-up communication over the time of quarantine in order to assess for any symptoms that may be showing up and to assess for their ongoing well-being. So now I'm going to talk briefly about technology in the contact tracing setting. So you may have heard in the news about technologies that can help with contact tracing. So let me explain a bit about the different technology options that are available for contact tracing. So there are, first of all, proximity applications. And these are applications that can either be downloaded on a phone or can be used through the Bluetooth technology that's already on people's smartphones. Now, this can be a good way of notifying people of their exposure, but there are also privacy concerns, particularly in allowing access to location information. There are also challenges with uptake in particular in communities that are at highest risk and most vulnerable. So, for example, they may not have access to the technology, or they may be skeptical or concerned and not trusting and not wanting to download the applications on their phones. So again, this can be a useful type of technology, but it can't take the place of public health, the public health response of health departments who can provide wraparound services for contacts in order to help them successfully isolate or quarantine. Now, a different type of solution, technology solution, is online case management tools. Now, these are basically online databases used by health departments to improve workflows and to make their operations more efficient. Now, they have a lot of positive attributes. They can allow multiple users to enter data and retrieve data. And they can track cases and contacts through the continuum from the time that they're identified as a case or contact, through their isolation and quarantine period, and on through the course of the disease if they do get sick. It also enables SMS messaging and follow-up over time. and it allows for the expansion of a remote workforce because multiple people can be working on a team together using the same database, but they're in different locations. And as I mentioned before, it improves workflows and makes the health department's operations more efficient. So in order for contact tracing to be successful, it needs to happen quickly. And this is a way that technology can help by reducing the amount of time it takes from the time that a case tests positive to when that person's contacts are notified. Now, this slide shows a couple of different scenarios. The first is you see a sick person who's exposing two other people, their close contacts. And then those two people go on and each expose two more people. And on, and you can see transmission is out of control. Lots of people are being infected from this single sick person. Now, in the case of rapid case investigation and contact tracing, contact tracers call those first two contacts right away and let them know that they've been exposed. They can quarantine immediately, and then transmission stops. Now, remember, as a contact tracer, you're calling a stranger out of the blue with difficult news. So having public buy-in to get people to answer their phones and cooperate is very important. So the contact tracing team needs to be viewed as an advocate for the communities most affected, and this requires community engagement. Now, there's several ways to do this by engaging local networks and community-based organizations, emphasizing solidarity and that this is for the common good and for the health of everyone. Leveraging a workforce from within the communities most affected and ensuring confidentiality, which we talked about earlier. So to wrap up, I just want to review the learning objectives for this module. We hope that by now you're able to summarize the goals and activities of contact tracing and to explain the relationship between these two activities, case investigation and contact tracing. And finally, we hope you're able to describe the different types of technology available for contact tracers. I want to close with a quote. This is from an actual contact who was called by contact tracers in San Francisco. She said, "I want to cry, but of happiness. You have provided extraordinary assistance to my family. Nobody had ever given me food or cleaning supplies. We all got tested and we were all negative. God bless you and all the work you do." So this is to say that this is really important work and it has a material impact on people's lives. Thank you.